Claire and I have been interested in trial design for a while, and we both ran randomised control trials where we realised that because it was such an artificial setting, that it could impact on the homeopaths, wondering, am I giving placebo, am I giving the real thing? Claire was already interested in that, so she started to develop ways of reducing the impact of the researcher on the participants, whether they be a patient or a therapist. And she's been working with something called a Zelens design. Fantastic work, really, where she's now got 5,000 people, all with chronic pain, whom she can now research on. Having kind of developed a body of patients where their outcome measures are being measured all the time. So now you bring in an intervention, but they hardly know anything is happening. The biggest challenge is the idea that a placebo response is nothing. In other words, it's not worth anything. And so that one of the dilemmas is that because we're so therapeutic in the consultation, we're enabling we create what are called context effects. In other words, there are effects of what we're doing that start to open up people's ability to self-heal, self-regulate. We know that expectation is a big part of that, but expectation is fascinating, both the expectation of the therapist and the patient. One of the pieces of research I was most struck by is one where the dentist was told that he was giving a pain-increasing drug to his patients within a trial design, and he was told that the other half were getting a pain-reducing, and you saw a beautiful kind of pain getting worse in one group, pain getting better in the other, and everyone was getting placebo. So just his expectation was very powerful. So you can imagine the expectation of the homeopath can often be very strong. And then what happens is you start to unpack that person's problems in a lot of detail, things like disclosure, things like something that my husband, who's another researcher, coined was homeopathicity. In other words, how homeopathic is that stimulus? And if it's very homeopathic, then you can get a real shift within this idea of the simillimum. Now, if you put that all into a trial and have consultation plus remedy, consultation plus placebo, you're going to run into big problems. And that design is difficult because the purists say it has to be a placebo-controlled trial for me to believe that there's an effect. Whereas if we were allowed to do more waiting list control trials or usual care trials, then we'd begin to develop evidence. I'd want to use all trial designs, including placebo-controlled trial, but if we did placebo-controlled trial, we'd need a complex remedy with no consultation in a single condition, which ideally would be acute, so that you don't get some of the context effects that build up in chronic disease, which are things like the meaning of your illness, the meaning of not getting well, hopelessness, all of those things, whereas in an acute, a lot of those things aren't playing. But most of the time, because we're working with chronic disease, I want to see all the other designs being used. We're in exciting times. Things are breaking down, structures are breaking down, financial systems in the world are breaking down. The NHS is part of a process of breakdown at the moment. It's got too big, it hasn't been able to contain itself. And I think that we offer something very sustainable in the future. And I think that the reason it's exciting times is that we have held together during a very difficult time, where we could have easily put up our hands and said, let's just, stop doing homeopathy. But a number of us within the professional homeopath community, the doctor homeopath community, have just kept going. So my feeling is that we're going to move into a time of growth. We're going to need to do it differently. We're going to need to, I think, become more humble around what homeopathy can do and be willing with research to really witness what it can and can't do. But then I think that we are actually, hopefully, going to start to create health and well-being, and we're going to be part of that. And then we're going to be more into health prevention in more routine ways. So although I think the last decade has been really tough, I actually think we're breaking through into exciting times. I think sometimes the homeopathic community hasn't realised how frustrating it's been for conventional doctors to see people who were persuaded to just use homeopathy and then for them to have to pick up the pieces when their blood pressure shot through the roof or their diabetes couldn't be cured or things that were unrealistic being offered to them. And I think that, again, there's been problems on both sides, but part of integration or integrative medicine is where it is not for one to criticise the other, but to work together for the good of each person. In fact, what I mean is the biomedical model and the holistic model. So the biomedical model sees the body in parts, and a lot of holistic approaches like acupuncture, like homeopathy, see it as a whole. And I think that the biomedical model can't sustain itself because, you know, quite clearly the body is not made up of parts, it's a whole system. But unfortunately people have been a bit tribal and are still quite tribal about it. I'm doing this because it's like what we need to do is to realise that again we can work together.